it's often when patients present with missing teeth or history of missing teeth, they normally certainly had most patients that present with missing teeth. We always have the opinion that because there's a missing tooth in the front, you have to put implants. Now, implants can be indicative of missing teeth, both front area, or anterior, or back area called the posterior area, but that's not always the option. In other words, some cases we prefer not to place implants. Especially in our case, our lovely patient, she's 25 years of age. She had missing teeth. She had missing teeth, upper lateral incisors had been congenitally missing. And so when the orthodontic treatment was completed, the decision was made to consider fixed tooth replacement using resin bonded bridgework. Now, you're probably wondering, what am I talking about? Why can't you put an implant here? Well, first of all, at the time when the patient completed orthodontic treatment, she was about 16 years of age or 15, and we don't want to place implants at a young age because the body grows and implants don't grow, they stay, and it can cause a lot of problems when you place implants at a young age. But also the fact that this bridge lasted so well. Now for almost more than 10 years, it was due to be replaced. Now no tooth was cut with resin bonding bridges, very minimal, small refinement, so we call preparation, which requires no injection. And that is basically done on the enamel. So we basically need about 0.5 millimeter enamel to be able to bond this special bridgework. As you can see here, okay, and that's bridgework has been in place for so many years. It's done very, very well. And the patient wanted to replace because the metal that was used at the time, and this is quite a good dentistry, this is excellent dentistry. The metal plate that was placed in that time causes some graying of the tooth over here and over there. You can see a bit of a bluish graying here, and patient was concerned about that. And also, where you can see really closely, the bone remodels under the bridgework, and there's a bit of space and foot impacts there, and the same here, there's a bit of space and foot impacts here. So to move forward in our case, we look at the x-rays, for instance. You can see on the x-rays, the area here is very small to place an implant. There's slight change in root angulation, and I accept that. But to put the patient through unnecessary orthodontic treatment to create space to place an implant is absolutely not indicated. And I refuse to do this because there are simpler and better, less invasive options than simply placing implants in the front part of the mouth, where it's really not the best option for that patient. Now, when we talk about replacement of teeth in the front area, there's a good literature that actually explains and states it's actually, you could say, a standard of care now, it's accepted almost, that single tooth replacement, if it's a right case protocol, should be considered using resin bonded bridges rather than implants in the first instance, provided it meets the protocol. Having said that, you can see that we haven't got enough area to place implants, even if it was required. We have a simple option. Patient maintains an excellent oral hygiene, so there's no reason why we cannot replace that bridgework that's been there for a while. It does very well with a new material type of implant supported bridgework. But before that, what we would normally prefer to do, we want to whiten the patient's teeth. We want to whiten your teeth because it's been a while. The color needs to be improved, if you want, that is, okay? But most people prefer to have a tooth whitening before you start replacing some of the old crowns and bridgeworks, because why not why not? A lot of people want to have a fresher look, and we're here to do it for you. And having said that, the tooth whitening was amazing for this patient. You can see over here, that's the natural porcelain old bridgework that didn't whiten, okay? And this is the new level of the tooth whiteness that was created, and it was most desirable for our lovely patient. Having said that, we're now in a position to proceed to remove the the old resin bonded bridgework that have functioned so well, and I certainly commend the dentist who did this some time ago. He's now retired. I ring him up and I say, I want to thank you for doing an excellent job for your patient. And it's wonderful to see a very caring dentist who years ago didn't cut teeth but did bonded bridgework for a lovely patient. And what we did then, we took the impressions, we cleaned up a little bit, and you can see these are study models. And this is now new concept with zirconia wings, both of them, hooking off the canine. You can see on the canine with the zirconia wings, it's bonded to the tooth, okay? And with the final result, as you can see here, for our patient, that's before, okay? And this is the actual left side, the bonded bridgework using zirconia. This is the right side. And you can see in the middle how beautiful result we get with good aesthetics, good outcome, simply copying the old design that has functioned very well. So we have simpler versions to do good aesthetic and functional dentistry with minimal intervention. So just to reiterate, implant is not always an indication for a missing tooth. We always had alternatives. This is traditional prosthodontics. It's very important not to lose the view of how dentistry should be going. I as a specialist prosthodontist, my aim is to conserve tooth structure, especially when I'm replacing teeth. So therefore, in our particular patient, we have issued the resin bonded bridgework. RBB stands for resin bonded bridgework. And as you can see, different views of the angle, how natural it looks, what improved premergence profile. You wouldn't know that that's a missing tooth. You see, you wouldn't know it's a missing tooth because we do a special thing called gum fitting. We call it ovate pontics. So it just fits on the gum there. It creates this effect that it's just growing out from the gum. And that's good aesthetics. That's good thinking. It's all about planning. See, my role as a specialist is to plan the final treatment outcome. How is it going to look? What are the consequences if you do this? What are the consequences if you do that? So it's very important. I get the whole family involved. It is more or less, when you think about the smile the patient achieved, and we had our parents with us, and you can see all the different view that we have, and the patient's so happy, as you know that patients smile with their eyes. They don't smile with their teeth. And when you think about this, I have parents involved here. You probably see it in the video later on. And we all like to get in the photos and take some decent shots of each other. And I really enjoyed having our patients and our family here from Newcastle. From the aesthetic point of view, you already have this for a few hours. You went and ate something. Just from aesthetics initially, how do you feel?
I feel like I've got the perfect set of teeth. I can smile and do everything that I need to do, and it feels perfectly normal, and I finally have a smile that I'm happy with, which is great. And yeah, I don't think I could think of anything better than this.
Thank you. I appreciate that. Next question is, was it, when we discussed your treatment plan, was there anything that we didn't cover that we already did for you? Did we go through the whole procedure? You want to discuss that a little bit more for me?
Yeah. So you went through everything from start to finish. I had to go through and talk me through step by step. So I felt really comfortable with everything and didn't have any questions. And yeah, the procedure was really easy.
My pleasure. We probably have to ask a question, Mom, around here. Where's Mom? Mom, what do you think? You can speak. What do you think, Mom?
I'm really, really happy with the whole process. We've been through a lot with Tamara, with her mouth, and I never knew what was going to happen at the end, but I couldn't be more pleased with the outcome. It's better than what I expected it was going to be, and I'm so happy for her.
She's a beautiful girl, you've had. You have fabulous parents, both of you. It's wonderful. Here you are. There you are. We're both together. Okay. It's a big family affair, isn't it? Really,
Yeah, it is. Yeah.
The question is, it's about taking time and planning, isn't it? Like, you remember, if me and Derek didn't plan this, we probably couldn't get there. It wouldn't be as good. But with an average,
Yeah.
It wouldn't be as perfect, would it?
Yeah, I went to a couple of dentists actually before I came to you, and they had no idea what to do. They didn't have any planning or anything, so I was so happy when I went to you and Derek, and you had a plan, and it seemed really easy, and the process was great. Recommend it, highly recommend it to everyone.
Thank you very much. And thank you for allowing me to use your case for education. You know, it's very important. In my website's education, my lecture's education.
Thank you so much.
Thank you very much. Well, here's my photos, and we're all having interesting times around taking photos. I like to get involved with our patients. I want to make sure they're all happy. And if I'm really happy with the dentistry, I'm sure you'll be happy as well. Thank you.